A very warm welcome to this live show. This is a special segment on positive stories, which is stories of strength, where we invite all those people who are helping the world battle the coronavirus pandemic by making it a better place. So today we are joined by Dr. Ajay Ponugoti, who's an MD, Franciscan Health, Indianapolis. Thanks a lot for joining us, sir.
Thanks, Anubhuti, for giving an opportunity to talk to you guys.
So I would like to tell my viewers that you're joining us from US. So given the current situation and what is happening across the world, we are in the second year. And here in India, it is the second wave of the pandemic, and we are facing a really harsh time. What do you make of the present situation?
Well, first of all, I wanted to say that our prayers are with you guys. I moved to US 25 years back, but my heart still beats for my motherland. And so we're all here to support you. We have gone through this phase. I'm a physician. I've been taking care of COVID patients for the past 1 year. When it first began here, we were in the same situation as you're in today. I strongly believe that as time progresses, that you will see the end of the tunnel and you'll be in a better place. But we have to go through this tough phase. And I'm very positive that in the next month or so, we'll be in a better situation.
Well, yes, given that, yes, United States has gone through something very similar to what India was witnessing, and there was a long time when the cases weren't reducing. But then, yes, United States did see that end of the tunnel. The cases have come really down. So how was your own personal experience battling all of that?
Well, it was very challenging initially, just like how India is going through. It's in a shock phase. When we first started, we didn't know how to treat these patients. I still remember my second patient dying on me within a matter of hours. Oxygen dropped. But as time progressed, we started understanding the disease better. We started coming to grips as to what to do, how to contain. And until you vaccinate majority of the population, you have to find the means to contain, which means even the citizens have to take it upon themselves to do the basic, social distancing, wearing masks until they're vaccinated. And that's the only way we here in America have found our way through this.
Yeah. So as this special show is kind of dedicated to all those people who are working towards bringing relief to all those people who are reeling under the pandemic, can you tell us more about your organization? What is your NGO doing to help all those people, especially here in India?
Well, every Indian who are actually here in America is actually beating back for their motherland. It's just not me. Every single person that I know, I know someone in India who's affected, maybe their parents, maybe their friends. I am also the chairman of India Association of Indianapolis. So the most important thing is also for Americans, who 99% of the Americans are not Indians, for them to realize what India is going through, and then there's a matter of time that we all have to come together. So we, India Association, have put forward a message to Americans and Indians Americans of Indian origin to come together and give us oxygen concentrators, give us fundings to help to send back to India to raise funds. And we have been fortunate. Not only did we get financial backup, we also got very good moral support from Americans. And together, I'm sure we all can get through this.
So how did this idea come to you? When did you really decide that now things have gone really bad, it's time to just step in? And also, who all are the people who are really involved with this, and what are the plans right now?
Well, surprisingly, if you look back, just a few months back, it was us was barely making through this COVID situation. We looked up to India and hey, they're doing great. And in fact, I lost my father, not from COVID, but during the first phase of, and I couldn't even come to India because it was a lockdown. So I was planning to come and do his last rites in July. So and all of a sudden, I call India, and then I have a lot of people getting sick, and then I watch TV, and slowly it became a news for everyone. It's not news anymore. So we realized it came to us in a shock too. So we all mobilized as soon as we can. Everyone. There's not a single person that I know that who is not doing something back to their motherland, something to help someone back in India. And I think it's it's just a humanity. This is a humanitarian thing. We're doing this for not only for ourselves, for just because we're Indians, but because we would do this for any other humans in trouble. So
Yeah. So as a doctor, you said that you've closely witnessed the situation there in the United States. You were yourself in the COVID duty. So what is, in your opinion, that went wrong here in India, that the first wave ended, we had certain months where the cases had fallen drastically, and we almost thought that the crisis is over, and it was totally unprecedented when the cases, they started skyrocketing and it crossed 4 lakhs. So what exactly do you think went wrong?
well, if you look at the COVID, how the virus spreads, it doesn't matter which country you are in. It's a simple things. It spreads from one person to other person, from either the air or to other ways. But the basic thing is, I think it's not anyone's fault probably, because when the first wave was so mild, it is very common to believe that maybe India has some innate immunity, maybe the BCG. Even many physicians thought the same thing, that hey, India ducked this, they're doing great. But all of a sudden, I think what happened is maybe they got vaccination. And you understand, India is 1.6 billion people. America is 300 million people. So you have a lot of people congregated in a small area, which is very fertile land for virus to spread. And during this time, in the few months, I think the virus had a chance to make it more, to turn itself into a more powerful weapon, so that it can easily survive the humans by way of mutations. So all this was a perfect storm for a virus to come and hit a population where, when you live in such a small quarters, it's not very hard to go from one person to other person. And in all fairness, you're talking about America, which has a very, very, well positioned at that time. We thought of handling such situation. We all knew that it didn't. In fact, in the first several months, we were in the same situation as what India was, where, and you're talking about 1.6 billion people. I don't think it's humanly possible to have a structure in place to handle this kind of. It's easy to blame someone, but honestly, in all fairness, it also falls upon the citizens itself. Like we tell our patients itself, you have to, if you don't want to get this virus, you have to follow certain things. So it is, I think it is mathematically very favorable for the virus to do what it's doing now, and coupled with lack of facilities in India, this is where we are.
Sure. As you rightly pointed out that, yes, the virus has mutated in different waves. So as we saw in the second wave of the pandemic, there were very new symptoms that hadn't been seen before. For example, I also got COVID. And the initial symptoms were such that I couldn't even realize that this could be COVID-19. It started with an intense body ache, and the fever came quite many days later. Like initially, I was in a dilemma whether I should get myself tested or what should be the course of action. So do you think that in the United States as well, you have witnessed a change in the kind of symptoms that have emerged in people in the waves or over time?
The virus doesn't read book. And it is even worse with COVID virus. I have seen people come, initially we didn't even know if people would come from different symptoms. Some people would come with just diarrhea. Some people would come with nausea. Some people would come with lack of smell, so some people would come with heart attack and they would have COVID. People would come with strokes, they would have COVID. Some people would come with shortness of breath. So COVID can come in many ways. And we are learning as we go, from not only when you have COVID, but also what happens after having COVID. I have people who are only 20 years old, 25 years old, who after 5 months of COVID still struggling from the symptoms. So this is a very, it's a disease that we're learning as we go, and it can come in any form.
So, as a doctor, do you think that the new issues that people are now facing, for example, there's a report that even people lower than 20 years of age are now experiencing something called long COVID, where we see that symptoms like mind fog, body ache, and mild fever and joint pain, especially, is emerging. They're complaining after 6 months or even a year after they had COVID. So, this is something that is creating a kind of a panic among people that, it will take that long really to recover fully.
That is a valid point, and it is true. I have patients who have, we call long haulers. These patients have been having symptoms for months, more than a month, more than 2 months. Some people have brain fog. Some people have dizziness. Some people have, weakness. That is true. All these are true. Most of it is, we think, is caused from the inflammation. Once again, there are actually few centers here who are actually working on those patients, trying to figure out what's going on. We have, in my own clinic, we have a separate, rehab area for these people. It is true. That's why it's very important to understand. One, go get your vaccine. Two, try your best not to get this. If you do get it, make sure you see the right doctor, because it's very important to do certain stuff at the right time. Like, do not take the steroids in the wrong time, but do take the steroids at the right time. So it's very important you work with your doctors. Very important there's no need to panic. Panic doesn't bring anything. It is important to understand the disease, and I'm sure we will get through this.
Yeah. So given that the cases are now finally coming down here in India, and we are looking towards the end of the tunnel, as you said, but there are people who are also quite skeptical about the fact that there could be a third wave. So it is almost very panicking, very scary for people to imagine that, you will be stuck in this pandemic for a very long time, especially here in India. So what do you think should be the kind of measures that now everybody should take to ensure that there is no third wave? I know the virus becomes more potent, it starts mutating, and it's very difficult. But what exactly, as a doctor, as somebody who has seen the situation, you suggest?
Well, from our own understanding, from what I got a COVID vaccine when I was in December, and after that I saw many COVID patients. Now in America, we don't even wear masks. So the most important thing for everyone to know is, number one, don't panic. Number two, do the right things. Do the right things. If you're not vaccinated, protect yourself. No one can protect you. Only you have to protect yourself. Do your best. I mean, even sometimes even after doing best, you get COVID, but at least then you did best. And try to distance yourself from people who have COVID. Always put masks, put double masks until you get vaccinated if you have to. So it's containment. Unless you get vaccinated, the only other way to do is containment. There's no other way, unfortunately. You look at London, you look at France, they have third wave. You look at Japan, the fourth wave. So the waves will come and go until you have enough population, either get community immunity, either by vaccination or by getting enough people getting infected. So that means if you that's what it is. So.
Yeah, talking about the immunity factor, we have seen here in India a lot of people who've got COVID twice, and I even know somebody who's got it thrice. So how will we ensure that somebody has that strong immunity? Because given that the antibodies do not remain in the body for a very long time, and with everybody it is different. They might stay for 2 months or 6 months, and then the thing is that even after getting vaccinated, there are people here in India who have got COVID-19. So it's really a big dilemma. Some people are really not convinced whether anything will save them at all.
Well, that's why you need to take a deep breath and understand the logic behind this. No, nothing is 100% proof. Even when you look at the studies, like the vaccines you're getting in India, the AstraZeneca vaccine is not 100%. It only, like 25% of the people can still have COVID. But the advantage of taking a vaccine is, even if you get second time infected, is that the chance of you getting into ICU, the chance of you dying is very less. In COVID does not kill you. You know what kills you? It is the inflammation that caused by COVID that kills you. No one dies from the virus. It is what the body does to the virus that kills. So if you do your things rightly, if you put a mask, if you have decreased viral load when you first get COVID, your body survives. If you get vaccination, even though immunity wanes, you might get COVID, you might turn positive, but your chance of survival shoots up highly. every single vaccine in this world has decreased the death rate for sure. So take any vaccine that's available, even the vaccine that you're listening to, say 1 in a million have a blood clot. Even that vaccine, look how many people, I have many people in India, my friends and family, who lost their lives under 50 years old, 50 years
Yeah.
age. Till today, in my entire career, so I've seen COVID for the last 14 months, I have not a single person who died from vaccine, but I have many, many, many people who died from COVID. So just, it's a simple logic, do the right thing.
And also, there is a lot of confusion over the usage of steroids. For example, I know people who were recommended by the doctors only to take steroids, and they did. But there were many others who took it on their own. And as you know, there are a lot of complications happening right now. There's something new, something more scary called as black fungus, where the cases are rising in most of the states. It has been declared like an epidemic. And so, one of the major reasons has been the unnecessary or overuse of steroids. So, what is your opinion on it?
Yeah, I'm glad you asked me this question because this is very important. There are only few things that are proven to be working in COVID. One is steroids. If you look at the data, the remdesivir that you guys are all fighting for and spending so much money actually doesn't work because there are many studies, and we as physicians never came and put our foot down and said, hey, don't take remdesivir because we didn't want a backlash on us. But the fact of the matter is that many times the remdesivir, if it works the day you got COVID. That means by the time you realize you're caught COVID, it's already beyond its working time. Even if it works in a. So by most of the people that are spending their money on remdesivir are actually wasting their money if they're already taking it at a later time. Number two, the steroids. The steroids are if you ask me what changed in my practice that has made many people survive the COVID after the initial few months, it is when we decided that steroids especially used at the right time. The reason why you're having problems is because you should not take steroids without your doctor's opinion. Because if you take it too early, you're giving the virus a chance to multiply. What happens is after 3 or 4 days of having the virus in your body starts reacting. You're giving the steroids because the steroids have this anti-inflammatory. That means it will help your body calm down and not react to the virus so badly, which fills your lungs with all the material that's causing you to have decreased oxygenation. It is very important to take the steroids at the right time, especially when you have infiltrates in the lungs. But please do not take it without asking your doctor. You should never take it for too long, and you should always take it under the care of a doctor. Yes, it is true, the fungus happens, especially if you're immunocompromised already, if you have diabetes, it is true. Every medication will have side effects, but the benefits of steroids, if you took it at the right time, is humongous. It is a life savior. But you have to do it under the care of a doctor, and the doctor also should know what he's doing. So there are two factors in this. But
and you have to phase it out gradually.
It's a misconception. Majority of the times, if you look at the studies, in people with moderate disease, the studies are done with Decadron. It's only 6 milligrams daily for 5 days. And see, a lot of people are sick. It's 10 days. But if sometimes I call India, they use whatever the steroids, whatever the dose. But that's fine. I'm not a physician. I'm a physician. Everyone has their own ways of practice. But in general, steroid has a huge role in the treatment of COVID patients. Not shy away from that, but do it at the right time. And so do it under the care of a doctor.
Also, there's a lot of dilemma when it comes to vaccination. Most of people, for example, even I'm still recovering from COVID kind of. And so, what is the ideal time to get vaccinated? Should anybody go for an antibody test first and ensure that there are no antibodies in the body and then take the vaccine? Or you can take the vaccine, you can take the jab after just 3 months?
Your jab, the way your jab works is different from the way how it works when you get infected by virus. It is very important that you get a jab irrespective of whether you got COVID or not, because the way the vaccine works, how it protects you, is beyond the scope of this discussion. But you will have a better protection with vaccine. I have patients that I have actually my partners and friends and nurses who have COVID and they took vaccine, because it's very important to get vaccinated even if you have COVID. because of the way it works. And we don't know how bad of a virus infection you got, how long your immunity lasts. So, these vaccines are amazing. It's actually a godsend, and we all should use it and get it as soon as we can. Only thing is, if you have less vaccines, this is for the government to do. If you have less vaccines, then it is right to say, hey, you got a virus. Why don't you wait for a month? Why don't you give it to someone who didn't get COVID? So that's more humanitarian way to do it. If you really want to, get a better result in your population altogether. But otherwise, everyone should get vaccinated, irrespective of whether COVID or not.
Yeah, true. Also, this is something that has been prevalent in, like we've seen it. I have, for example, even I did not step out of my house, and my mother went for a vaccination. And after that, it could be she got the virus at the vaccination center. But after that, she got COVID and I got it from her. So, of course, sensibly, it is only because she must have come in contact with somebody who already had the virus or something at the vaccination center. But there is confusion in people here in India. Many people think that, you could get COVID after the vaccination.
Well, because, it's not their fault, unless you're in a medical field, it's hard for them to understand, because you have to understand it takes a few weeks for your body to recognize the vaccine, to manufacture the antibodies for the vaccine. And then, depending on what vaccine you take, it takes 2 doses to have enough immunity to attack your, to get enough immunity. So it is true. You can get COVID infection in between the period where you got vaccine before you are completely immunized. But let me tell you, I'm not sure about the vaccines in India because I did not do much. Don't have much interaction with exactly studies. I've not seen much studies as to what exactly. But if you take the Pfizer vaccine or Moderna vaccine here, after the first shot, after 2 weeks, you have 50% protection. That means there's a good chance you will not die from COVID. After the second shot, after 1 week or 2 weeks, then you're fully protected. So during that time, you're still vulnerable. That's why we say, just because you get a jab doesn't mean that your helmet should go off immediately,
So on a positive point, you've been a doctor, you've seen all those things happening right in front of your eyes. Of course, it must have been very challenging even for you. So tell us something about the stories of strength that you might have seen around you, seen somebody who actually fought the virus.
Oh, you know what? Actually, if you look at it, 95% of the people who get COVID, they won't even know that COVID.
Yeah.
It's only less than 1% of the people who get too sick to come to the hospital. As I said, initially, when we first started, we were in a panic mode like you. Now, COVID we know how to treat it. Yes, we have still unfortunate people. People who don't take vaccines actually are the only one we are seeing now in the hospital. People who get vaccinated, I hardly see them anymore in the hospital. So, guys, you will be there. It is a matter of time. Just do what is right. You have to go through what you've already done, because it takes few months for you to because what is already done, it takes a while for you to go through this.
Sure.
But what is done, if you follow through steps, many people, there are many stories in this country which are great stories where people, I have actually many people who are 70 years old, 80 years old who go home after getting COVID. I have many people who are cancers who got COVID who went home. I have many people who, so it is not like if you get COVID, it's a death sentence. No, that's not like it. Right now, we know how to treat it better than before.
Yeah.
I'm sure you will be in the same place. You're already there. India is an amazing place. It's very resilient. It will come through this. It's just a matter of time. Unfortunately, whatever happened, but in the future, we will all come through this.
Yeah. Also, one question that now we see that a lot of children have contracted the virus here in India. The number of children getting it is becoming higher now. So what do you think? How difficult is it for a child to battle the virus? Or is it like life-threatening, or there are some, different ways how a child's body reacts or something?
If the virus decides to change itself and behave differently, which the future no one can tell. But from our own experiences, we had zero I mean, we have very, very little patients or kids who got COVID to sick. Some people got inflammatory disease from it, but it's very rare. So as of today, it's not a danger for kids. But the kids bringing home, the kids bringing to elders, because the kids can spread without knowing. And that is, kids giving to others is more problem than kids suffering from the virus. Having
So,
said that, having
yeah,
said that, the younger people in India that I know are losing their lives, which is very
yeah.
different than what we saw here.
True that. There are a lot of young people, a lot of people that I know. Every day is like a day when you hear somebody who's lost their battle with COVID. So at this point of time, in India and across the world, of course, the doctors are very under stress. All the frontline workers, actually, all the healthcare workers are really giving their 100% to save more and more lives. And, a lot of doctors are facing a burnout. What is your message as a doctor in America who has, worked in COVID? What is your message to all the doctors, all the frontline workers here in India?
Well, we all, I feel for you guys. It's whatever, what all of you guys are doing an amazing job. We all here to serve. At some point, it is also overwhelming, no matter how good of we are in serving our patient population. But in the end of the day, we all are humans, and we have only our biological clock works in a certain way, and we fight it. But the most important thing is what I did. I for a few months I didn't even give a hug to my daughter. I had my own family having some challenges which have immunocompromised, so it was very hard. And I'm sure most of you are burnt out because in India it's stretching for more time. Hats off to you guys. You're doing a great job. The only thing you can do is, do your best. Be positive. Take some time. Do some meditation. Do some exercise. Do what it takes, because I'm sure when you look back, you have done a great service to yourself and to your country, to your patients. And this is when you look back. When I look back, I'm not stressed anymore. I feel like it was a calling from God. There were times when I questioned myself as to why I'm in this field, because honestly, I can stop working, I would be fine. But it is during those times I realized I've actually helped many patients outside my hospital too, where people, just like how you asked me, when they would call me at 12 in the night. People now call me from India. Should I take steroids or not? Should I take remdesivir? I mean, this is, unfortunately, we have to get through this. And I thank you for all of you guys for doing what you do. And, God be with you, and we will all be with you. If I had a chance, I would come and work for you guys.
Yeah, that's very kind of you. Also, the good work that your organization is doing. Tell us, our viewers, how people in India, if they need help, can reach out to you. What is the kind of help that your organization can provide at this point of time?
Yeah. The beauty of America is if you look at the data, Americans are the most kind people. They're most generous people. And we, people of Indian origin who live in America, also the same. We are going through our own phase, but we still have some space in our heart left to share. And we are here to share. There are many organizations in this country which are collecting money to save our organization. Like, say, even every city has, like temples, like my India Association of Indianapolis. We are collecting money. The challenge is, like, for example, I send oxygen concentrators. Sometimes they get stuck in the customs. I mean, these are logistic problems, but in general, you can call any one of your people, that your friends or family, if you need something. I'm sure, like one day I was driving to work, someone in India called me, hey, in my village, people have no oxygen concentrators. That's when the idea of oxygen concentrators came. I immediately asked my hospital, they provided me some, I sent back to India. So we are all here to help you. You can Google all our associations. There are different parts of the city. We have 50 states. There, just like in India, there are many organizations here. And honestly, everyone is willing to help. They're eager to help. Their heart is with you guys. They wake up and think about you guys. No one, we live here. We love America, but our heart still beats for our motherland. And you have to understand, there's nothing more important than coming together for you guys. We will be with you guys. We'll do our best.
Yeah. Thank you so much for joining us. This has been a very insightful discussion. And any last message that you'd like to give before we close the show?
Well, most important thing is pray to God and believe in yourself. And I'm sure that together, by next year, we will look back and we will believe that this is behind us and it is in our rearview mirror. I pray for India again, and thank you very much.
Thank you so much for joining us. And I'm sure that all those people who are watching us, it must have helped them a lot, given them a wider perspective on the issue that we are facing here in India. And we're sure that very soon we will also be out of the crisis and we will also vaccinate more and more of people around. So keep watching us and we will be back with more stories of strength. Till then, stay safe and get vaccinated.
I am already vaccinated. Thank you very much. And every one of you get vaccinated. And I'm sure you'll all be smiling soon. Thank you very much.
Thank you.